Last week, a 72-year-old patient walked into my office complaining of severe joint pain that had been getting worse for months. She was convinced she needed surgery. But when I reviewed her diet diary, I found something shocking. She was eating tomatoes in a way that was actually making her inflammation worse. And she's not alone. Millions of people are making the same mistakes with this seemingly healthy food, unknowingly affecting their heart health and joint function. I'm Dr. Emily Hartman, and I've been practicing cardiology for over 15 years. Throughout my career, I've seen countless patients whose health conditions were being influenced by simple dietary mistakes they never knew they were making. Today, I want to share with you the most common and dangerous mistakes people make with tomatoes, and how these errors can affect your cardiovascular system and joint health in ways you never imagined. Before we dive in, if you haven't subscribed yet, I highly recommend hitting that subscribe button and turning on notifications so you never miss another health tip made especially for you. If you find this video helpful, please leave your questions and video suggestions in the comments. I read every single one, and it helps me create more content to help people just like you. Now, let me start by saying that tomatoes are incredibly nutritious. They're packed with lycopene, vitamins, and antioxidants that can support heart health when consumed correctly. But there's a catch, and it's one that most people completely overlook. Let me tell you about Maria Santos, a 68-year-old retired teacher from Porto Alegre. Maria loved cooking and prided herself on eating healthy. Every morning, she'd make herself a large glass of fresh tomato juice on an empty stomach, thinking she was doing something wonderful for her body. She'd been doing this for 3 years. But what Maria didn't know was that this habit was contributing to her worsening acid reflux and was slowly eroding her tooth enamel. The acidity of tomatoes on an empty stomach was creating a cascade of digestive issues that eventually led to chronic inflammation in her esophagus. When she came to see me complaining of chest discomfort, she was terrified it was her heart. After a thorough examination and reviewing her habits, we discovered the real culprit. Maria told me, with tears in her eyes, "Doctor, I thought I was being so healthy. I never imagined something so natural could cause problems." This brings me to the first critical mistake: consuming tomatoes on an empty stomach, especially in large quantities. When you eat tomatoes without other foods to buffer their acidity, the high levels of tannic acid and malic acid can irritate your stomach lining. For people with sensitive digestive systems or those prone to acid reflux, this can trigger inflammation that doesn't just stay in your stomach. Chronic digestive inflammation can actually affect your cardiovascular system by increasing overall inflammatory markers in your body. These inflammatory compounds can travel through your bloodstream and affect your joints, potentially worsening conditions like arthritis or triggering joint pain in people who are predisposed to inflammatory joint conditions. The solution isn't to stop eating tomatoes. It's to consume them with other foods, particularly those containing healthy fats or proteins that can help neutralize the acidity and slow down the absorption of potentially irritating compounds. Having tomatoes as part of a balanced meal, rather than isolated on an empty stomach, makes all the difference. But if you think that's surprising, wait until you hear about the second mistake that's even more common. I remember Mr. João Ferreira, a 75-year-old retired mechanic from Belo Horizonte. João had been taking blood pressure medication for years, and his condition was well managed. He loved his wife's homemade tomato sauce and ate it almost daily. But about 6 months before I saw him, he started experiencing unusual symptoms: irregular heartbeat, muscle weakness, and fatigue. His wife was worried sick, thinking his heart condition was deteriorating. When we ran comprehensive blood work, we discovered something unexpected. His potassium levels were dangerously high. João was consuming massive amounts of tomato-based products, sometimes eating 2 to 3 cups of tomato sauce daily, not realizing that tomatoes are extremely high in potassium. Combined with his blood pressure medication, which was a potassium-sparing diuretic, he was creating a perfect storm for hyperkalemia. João looked at me, confused and scared, and said, "But doctor, everyone says tomatoes are healthy for the heart. How could they be causing problems?" This is the second critical mistake. Not considering how tomatoes interact with medications, particularly blood pressure medications and blood thinners. Tomatoes are rich in potassium, which is generally beneficial for blood pressure control. However, if you're taking certain medications like ACE inhibitors, ARBs, or potassium-sparing diuretics, consuming large amounts of tomatoes can lead to potassium accumulation in your body. Hyperkalemia, or high potassium levels, can cause serious cardiac arrhythmias and muscle problems. Your heart relies on precise electrical signals to beat regularly, and these signals are heavily dependent on the balance of minerals like potassium in your blood. When this balance is disrupted, your heart rhythm can become irregular, potentially leading to dangerous situations. Additionally, tomatoes contain vitamin K, which plays a role in blood clotting. If you're taking anticoagulant medications like warfarin, suddenly increasing or decreasing your tomato intake can affect how well your medication works. The key is consistency and communication with your healthcare provider about your diet. If you're still watching and finding this information useful, comment below to show you're following along. Your engagement helps me create more content like this. Now, let me share something that absolutely shocked me when I first learned about it during my residency, and it's a mistake I see constantly in my practice. I'll never forget Mrs. Ana Paula Costa, a 69-year-old seamstress from Curitiba. Ana Paula came to my office with swollen, painful joints in her hands. She could barely hold her sewing needles anymore, and it was breaking her heart, because sewing wasn't just her livelihood, it was her passion. She'd been to rheumatologists, tried various treatments, and nothing seemed to help long-term. During our conversation, I asked about her diet. She mentioned that she'd started buying canned tomatoes in bulk about 2 years ago because they were convenient and affordable. She used them almost every day in her cooking. When I explained the potential connection, she was stunned. You see, many canned tomatoes are stored in containers lined with BPA, a chemical that can leach into acidic foods like tomatoes. BPA is an endocrine disruptor that has been linked to increased inflammation and cardiovascular problems. Additionally, canned products often contain high levels of sodium, which can contribute to high blood pressure and water retention that makes joint pain worse. This is the third critical mistake, relying heavily on canned or processed tomato products without considering what else you're consuming along with them. When tomatoes are canned, especially in metal containers, the high acidity of the fruit can cause chemicals from the lining to leach into the food. Beyond BPA concerns, canned tomato products often contain added salt, sometimes containing 400 to 700 milligrams of sodium per serving. For someone with heart disease or hypertension, this hidden sodium can sabotage even the best treatment plan. High sodium intake doesn't just affect your blood pressure, it also promotes inflammation throughout your body, which can worsen joint pain and stiffness. When Ana Paula switched to fresh tomatoes and low-sodium alternatives, and we optimized her overall anti-inflammatory diet, she noticed improvements within weeks. 3 months later, she brought me a hand-sewn pillowcase as a thank you gift, with tears of gratitude in her eyes. But the mistakes don't stop there. Let me tell you about one that's particularly relevant for those of you worried about joint health. Mr. Carlos Mendez, an 81-year-old former bus driver from Recife, had been suffering from osteoarthritis for years. His knees were so painful that he'd stopped taking his daily walks, which he'd done religiously for decades. His family was worried about his declining mobility and mood. Carlos loved his traditional northeastern cuisine, especially dishes heavy with fried green tomatoes. He didn't realize that unripe green tomatoes contain higher levels of solanine, a compound found in nightshade vegetables. While ripe tomatoes contain very low levels of solanine, green tomatoes have significantly more. For some people, particularly those with inflammatory conditions, solanine can trigger or worsen joint inflammation and pain. Not everyone is sensitive to solanine, but for those who are, the effects can be significant. This is the fourth critical mistake: consuming large amounts of unripe or green tomatoes, especially if you already have inflammatory joint conditions. Solanine is a natural pesticide that plants produce to protect themselves. In sensitive individuals, it can interfere with calcium metabolism and contribute to calcium deposits in soft tissues, potentially worsening joint problems. Some research suggests that for people with rheumatoid arthritis or osteoarthritis, reducing nightshade vegetables, including tomatoes in their unripe form, may help reduce inflammation and pain. Now, this doesn't mean everyone needs to avoid green tomatoes or that ripe tomatoes cause problems. The key is awareness. If you have chronic joint pain and consume a lot of nightshade vegetables, it might be worth trying an elimination diet under professional guidance to see if reducing these foods helps your symptoms. When Carlos reduced his intake of green tomatoes and increased his consumption of ripe, cooked tomatoes instead, combined with other dietary modifications, he noticed his joint pain becoming more manageable. Within 6 months, he was back to taking short walks, and his mood improved dramatically. Let me share another case that highlights a mistake many health-conscious people make. Mrs. Beatriz Lima, a 70-year-old yoga instructor from Florianopolis, was one of the healthiest patients I'd ever met. She exercised regularly, meditated, and was extremely conscious about her diet. She'd read that lycopene in tomatoes was good for heart health, so she started eating multiple raw tomatoes every single day, sometimes 4 or 5 large ones. She was convinced that more was better. But about a year into this habit, she started experiencing digestive discomfort, skin changes, and ironically, her cholesterol numbers weren't improving as much as she expected. When we discussed her diet in detail, I realized she was making a crucial error. This is the 5th mistake: eating only raw tomatoes and missing out on the enhanced benefits of cooked tomatoes. Here's the fascinating science. Lycopene, the powerful antioxidant that gives tomatoes their red color and provides cardiovascular benefits, is actually better absorbed by your body when tomatoes are cooked. The heating process breaks down the thick cell walls of tomatoes, making lycopene more bioavailable. Studies have shown that cooked tomatoes can provide 2 to 3 times more absorbable lycopene compared to raw ones. Additionally, lycopene is fat-soluble, meaning it's absorbed better when consumed with healthy fats like olive oil. This is why Mediterranean dishes that combine cooked tomatoes with olive oil are so beneficial for heart health. Beatrice was eating raw tomatoes without any fat, thinking she was maximizing benefits. But she was actually limiting the absorption of the very compound she was trying to get more of. When we adjusted her approach, having her consume a variety of both cooked and raw tomatoes, and ensuring she paired them with healthy fats like olive oil or avocado, she felt better, and her cardiovascular markers improved significantly over the next several months. But there's another mistake that's particularly dangerous for people taking certain medications, and it's one that almost no one talks about. I treated Mr. Roberto Silva, a 73-year-old accountant from Salvador, who had been managing his cardiovascular health well for years. He was on a specific type of blood pressure medication and a statin for cholesterol. Roberto loved making fresh tomato juice blends, and he'd recently started adding large amounts of tomato juice to his daily routine after reading about its health benefits. What Roberto didn't know was that grapefruit isn't the only fruit that can interact with medications. While tomatoes don't have the same level of drug interaction as grapefruit, consuming very large quantities of tomato products can affect how your body processes certain medications, particularly some statins and blood pressure medications. The flavonoids and other compounds in tomatoes can subtly affect liver enzymes responsible for drug metabolism. This is the 6th mistake: consuming excessive amounts of tomato products without informing your healthcare provider, especially if you're on cardiovascular medications. The issue isn't that tomatoes are dangerous, it's that extreme changes in consumption can affect medication efficacy or side effects. For example, the high potassium content we discussed earlier, combined with blood pressure medications, can create complications. Similarly, tomatoes contain tyramine, an amino acid that can interact with certain medications, particularly MAO inhibitors, though these are less commonly prescribed today. Roberto experienced unusual muscle pain and fatigue, which we initially thought might be side effects from his statin. But when we reviewed his diet and realized he'd dramatically increased his tomato juice consumption, we adjusted both his medication timing and his tomato intake to be more moderate. His symptoms resolved within a few weeks. He told me, "I never thought I needed to mention vegetables to my doctor. I figured only supplements and medications mattered." This brings me to a mistake that affects joint health specifically, and it's one that many people make without realizing the consequences. Mrs. Lucia Rodriguez, a 66-year-old baker from Brasilia, came to me with complaints of morning stiffness and joint pain that was affecting her ability to work. She'd wake up with swollen fingers and painful knees. Lucia was already watching her diet carefully, avoiding sugar and processed foods. But during our detailed dietary review, I noticed something interesting. She was consuming tomato-based foods almost exclusively in the evening, often as part of her dinner or as a late-night snack. She loved making bruschetta with tomatoes before bed. This is the seventh mistake: timing your tomato consumption poorly, especially if you're prone to inflammation or acid reflux. Eating acidic foods like tomatoes close to bedtime can trigger or worsen acid reflux, which leads to poor sleep quality. And here's the connection most people miss. Poor sleep quality is one of the most significant contributors to systemic inflammation and increased pain sensitivity. When you don't sleep well, your body produces more inflammatory cytokines, and your pain threshold decreases, making existing joint pain feel much worse. Additionally, lying down after consuming acidic foods allows stomach acid to more easily flow back into your esophagus, creating inflammation that can trigger a whole-body inflammatory response. For Lucia, we shifted her tomato consumption to earlier in the day and ensured she wasn't eating them within 3 hours of bedtime. We also worked on other sleep hygiene factors. Within a month, her morning stiffness improved significantly, and she felt less joint pain throughout the day. She was amazed that such a simple timing change could make such a difference. But there's one more critical mistake I need to share with you, and it's one that could be affecting your heart health right now without you knowing it. I'll always remember Mr. Ademar Pereira, an 83-year-old retired engineer from Porto Alegre. Ademar had been a patient of mine for years, managing his atrial fibrillation and high blood pressure successfully. He was meticulous about his medication and regular checkups. But over several months, his blood pressure readings started becoming erratic, sometimes dangerously high, other times too low. It was puzzling because nothing else had changed in his medications or lifestyle. During one visit, his daughter mentioned that he'd discovered a farmer's market and had been buying fresh organic tomatoes in bulk. He was so excited about the quality that he'd been eating them at almost every meal, sometimes consuming 8 to 10 tomatoes a day because they tasted so good, and he thought they were helping his health. This is the eighth and final critical mistake: not understanding that even healthy foods need to be consumed in moderation and balance. Tomatoes are nutritious, but consuming excessive amounts can lead to several problems. First, as we've discussed, the high potassium content can be problematic for people with kidney disease or those on certain medications. Second, excessive consumption of acidic foods can disrupt your body's pH balance and contribute to mineral leaching from bones, potentially affecting bone health. Third, tomatoes contain oxalates, compounds that in very high amounts can contribute to kidney stone formation in susceptible individuals. And finally, eating too much of any single food means you're not getting the diverse range of nutrients your body needs from other fruits and vegetables. The concept of dietary variety is crucial for both heart health and joint health. Different colored fruits and vegetables provide different antioxidants, vitamins, and minerals. By over-focusing on one food, even a healthy one like tomatoes, you miss out on the benefits of others. Ademar's case taught me an important lesson. Sometimes our enthusiasm for healthy eating can backfire if we lose sight of balance. We worked together to create a more varied diet plan that included tomatoes, but also incorporated other colorful vegetables and fruits. His blood pressure stabilized, and he felt better overall. He joked with me, saying, "Doctor, I guess you really can have too much of a good thing." So what should you do with all this information? Let me break it down into practical steps you can implement today. First, enjoy tomatoes as part of balanced meals, not isolated on an empty stomach. Pair them with proteins, healthy fats, or other vegetables to buffer their acidity and enhance nutrient absorption. Second, if you're on any medications, especially blood pressure medications, diuretics, or blood thinners, talk to your healthcare provider about your tomato consumption. Keep your intake consistent rather than dramatically changing it, and don't hesitate to ask if your specific medications have any dietary considerations. Third, prioritize fresh or frozen tomatoes over canned when possible. And when you do use canned products, look for BPA-free cans and low-sodium options. Read labels carefully because sodium content can vary dramatically between brands. Fourth, cook your tomatoes with healthy fats like olive oil to maximize lycopene absorption. Roasted tomatoes, tomato sauces made with olive oil, and other cooked preparations offer the most cardiovascular benefits. Fifth, if you have joint pain or inflammatory conditions, pay attention to how your body responds to tomatoes. While most people tolerate them well, some individuals are sensitive to nightshade vegetables. Consider keeping a food journal to track any connections between tomato consumption and symptom flares. Sixth, time matters. Try to avoid consuming large amounts of acidic foods like tomatoes close to bedtime, especially if you're prone to reflux or morning stiffness. Eat them earlier in the day when your digestive system is more active. Seventh, practice moderation and variety. Even the healthiest foods should be part of a diverse diet. Aim for a rainbow of colors on your plate throughout the week, not just red from tomatoes. And finally, remember that individual needs vary. What works for your neighbor might not work for you. Your age, medications, existing health conditions, and genetic factors all play a role in how your body responds to different foods. The most important message I want you to take away from this is that food is powerful medicine, but like any medicine, it needs to be used correctly. Tomatoes are wonderful, nutritious foods that can support your heart health and provide valuable antioxidants when consumed appropriately. The goal isn't to fear tomatoes or eliminate them from your diet. The goal is to understand how to incorporate them in a way that supports your unique health needs. I've seen countless patients improve their cardiovascular health and reduce their joint pain by making simple, informed adjustments to how they consume everyday foods like tomatoes. You don't need expensive supplements or complicated diet plans. You need knowledge, awareness, and the willingness to listen to your body. If you're currently taking medications for heart disease, high blood pressure, or any chronic condition, I cannot stress enough how important it is to discuss your diet with your healthcare provider. Bring a food diary to your next appointment. Ask specific questions about potential food-drug interactions. Your doctor can't help you navigate these issues if they don't know what you're eating. For those of you dealing with joint pain, consider working with both a rheumatologist or orthopedist and a registered dietitian who specializes in anti-inflammatory nutrition. The connection between diet and inflammation is real and powerful, but it's also highly individual. Professional guidance can help you identify your specific triggers and create a sustainable eating pattern that reduces pain and supports overall health. Remember, your health journey is exactly that. A journey. You don't need to implement all these changes overnight. Start with 1 or 2 adjustments that seem most relevant to your situation. Maybe it's switching from canned to fresh tomatoes. Or perhaps it's being more mindful about pairing tomatoes with healthy fats. Small, consistent changes add up to significant results over time. I want to emphasize something crucial. Nothing I've shared today is meant to replace personalized medical advice from your healthcare provider. Every person's situation is unique, with different medical histories, medications, and risk factors. Use this information as a starting point for conversations with your doctor, not as a substitute for professional medical care. If you're experiencing concerning symptoms like chest pain, severe joint swelling, or dramatic changes in your health, seek immediate medical attention. Thank you so much for watching today. I hope this information helps you make more informed choices about how you incorporate tomatoes into your diet. Remember, knowledge is power, especially when it comes to your health. If you found this video helpful, please share it with family members or friends who might benefit from this information. Leave your questions and comments below. I read every single one, and your feedback helps me create content that addresses your real concerns and questions. What other foods or health topics would you like me to cover? Let me know in the comments. Take care of your heart, take care of your joints, and remember that small, informed choices every day are what create lasting health. Until next time, this is Dr. Emily Hartman reminding you that your health is worth the effort, and you have more control over it than you might think.